Hi, I'm Dr. David Brownstein. I'm the medical director for the Center for Holistic Medicine in West Bloomfield, Michigan. And I'm happy to be talking today about the most important thing that I found in my 20 years of practicing holistic medicine, and it's the use of iodine. Now, I've written 10 books in my practice, and all these books are different things that I'm doing in my holistic practice. But truly, iodine is the most important thing that I've found to help my patients achieve their optimal health in the last 20 years. In this talk, I will show you how you can use iodine to help you and your family achieve their optimal health, and why you need to really consider using iodine in yours and your family's life. There's a lot of misinformation about iodine that's perpetuated by the medical community, and there's a term I'd like to acquaint you to. And this term is called medical iodophobia. And this term was coined by my mentor in iodine, Dr. Guy Abraham. And medical iodophobia is the unwarranted fear of using and recommending inorganic, non-radioactive iodine within the range known from the collective experience of 3 generations of clinicians to be the safest and most effective amounts for treating the symptoms and signs of iodine deficiency from 12 to 50 milligrams per day. Now you will see that this is well above the RDA for iodine, which is 150 micrograms per day. And my experience has been that these higher doses are effective for treating many clinical conditions, which I'll show you. These 2 handsome gentlemen in this photo are myself and Dr. Abraham. I met Dr. Abraham about 10 years ago after he wrote a letter to a journal describing how he had developed an iodine test. At that point in my medical career, I knew iodine was important in my practice, but there was no good clinical test for iodine. I started using Dr. Abraham's test and found that over 95% of my patients were deficient in iodine, and when I started prescribing the right doses of iodine, I started to see the clinical results I was looking for. Edgar Cayce, the sleeping prophet, said there are only 4 elements in the body: water, salt, soda, and iodine. If we have adequate amounts of these 4 elements in balance, the body is fully capable of creating all the other elements of the universe. There's no question we need adequate hydration, the right kind of salt, pH balance, and iodine. Now, I was taught in medical school that iodine causes problems with the thyroid, and if you have thyroid problems, iodine is going to make that worse. Well, this study showed that both benign and malignant thyroid nodules have significantly less iodine as compared to normal thyroid tissue. In fact, benign nodules contain 56% of the iodine content as compared to normal thyroid tissue, where malignant thyroid nodules only contain 2% of the iodine content as compared to normal thyroid tissues. This study is in direct contradiction to what I was taught in medical school. If iodine was a problem, we'd be seeing more thyroid nodules in those that had higher iodine contents, not less. Now, iodine was discovered in 1811, and it was first used by Dr. William Prout in London for treating a patient with goiter. And he found that the patient with goiter, the goiter size went down when he was treated with iodine. In 1820, Coindet reported efficacy in treating goiter with iodine, and he recommended iodine preoperatively to diminish the goiter size and the vascularity of the goiter. However, he encountered stiff opposition, with his opponents claiming iodine was poisonous. Coindet would not leave his house for fear of being stoned in the streets. Now, I've run into stiff opposition about my views on iodine from my colleagues, but I feel it's their lack of knowledge about iodine that is giving that opposition. And when you find out about iodine and use the physiology and biochemistry appropriately, you'll realize iodine is an important item that should be used in pretty much everyone's health regimen. Iodine is known as the birth of Western medicine, since Boussingault in 1824 observed that goiter did not occur at many silver mining sites. And he found that the miners who went into the mining sites, when they drank the water that contained iodine, their goiter went away. The use of iodine for treating goiter was the first time that a single item iodine was used to treat a specific illness, goiter. And in conventional medicine today, doctors are taught to make the diagnosis and to use the one drug to treat that diagnosis. Now, the RDA for iodine is 150 micrograms for a human, adult, male and female, and a little bit more for pregnancy and lactation. I will show you that the RDA might stand for rats, drugs, and assumptions, as it's probably enough for little rats to prevent problems with their thyroid and their breast tissue, but it's certainly not enough for humans in the toxic world we live in today. Now, the government takes a 10-year survey and looks at a cross-population of our citizens to estimate the amount of minerals and vitamins and toxicity that's occurring in the United States citizens. And from 1971 to 2000, the NHANES study showed iodine levels declined 50% in the United States. Now, during this time iodine declined 50% in the United States, we've had significant increased incidences of thyroid illnesses, including hypothyroidism, autoimmune thyroid illness, and thyroid cancer, as well as cancer of the breast, the prostate, endometrium, ovaries, as well as other endocrine cancers. And all of these conditions can be caused by iodine deficiency. Now, conventional medicine is reporting some of this iodine deficiency epidemic that we're seeing. And in this headline from my journal, it says many pregnant women may be iodine deficient. And they state that more than 70% of women with access to dietary iodine may remain at risk for unrecognized iodine deficiency during pregnancy. You will see that iodine deficiency during pregnancy results in a child with lower IQ rates, problems with ADD, and hormonal problems in the future. Now, iodine is vitally important during pregnancy as adequate iodine levels are necessary for the child's brain to develop normally. Now, these studies show that 16.8% of U.S. women of childbearing age had urinary iodine concentrations less than 50 micrograms per liter, which is what the World Health Organization says is severe iodine deficiency. That was in 2005. Another study in 2008 found 11.5% of pregnant U.S. women had severe iodine deficiency syndrome. 35.8% had moderate iodine deficiency, and 5.2% were near zero on their iodine levels. And I say this is a recipe of disaster for our country. Now, if we graph out these numbers, you can see from 2005 to 2008, we have a severe iodine deficiency problem going on in the majority of our female population, and this is leading to disastrous complications in our newborns. So 3 groups of children were studied here. Group 1 were supplemented with 200 micrograms per day of iodine at 4 to 6 weeks of gestation, so that's in the first trimester. Group 2 were supplemented with the same amount of iodine just at the end of the first trimester, 12 to 14 weeks of gestation. And Group 3 were not given iodine until after delivery, and they were given the same amount of iodine. All the children were given a neurocognitive evaluation at 18 months of age. This slide shows the results of this study. You can see clearly that Group 1 subjects who were treated with iodine in the first trimester had the highest IQ. Group 2 and 3 subjects who were treated later with iodine had a lower IQ, and a difference of 12 weeks of giving iodine from the beginning of the first trimester to the beginning of the second trimester was significantly decreases in IQ. Women need to be treated with iodine before they're pregnant to get the best results for their children. This was a meta-analysis of 18 studies of children and adolescents. The authors found that iodine deficiency was associated with a 13.5-point lower IQ score in children and adolescents. Now, we know iodine has immune system properties to it. It's been shown to increase the movement of granulocytes into areas of inflammation. It improves bacteriophagocytosis, or destruction by the white blood cells, and it improves the ability of the granulocytes or the white blood cells to kill bacteria. And we know iodine has a major physiologic role in the inflammatory process. So why look at iodine? Iodine deficiency is a worldwide problem. Its deficiency causes mental impairment, reduced intellectual ability, ADD, autism. It causes goiter, infertility, and an increased risk of breast, prostate, endometrial, ovarian, and other cancers. Now, the newborn thyroid gland only holds a 24-hour reserve of iodine, and therefore fresh sources must be supplied in the diet. This study showed that 47% of women sampled may be providing insufficient iodine to meet the infant's requirements in their breast milk. 13 breastfeeding women were looked at in this study. Their milk was studied. 92% had inadequate iodine in the breast milk, while 69% were high in perchlorate. Perchlorate is a byproduct of rocket fuel. So the authors were dismayed to note that while little of the maternal iodine finds its way into milk, the bulk of the perchlorate intake ends up in milk. Perchlorate is a toxic substance. It's a byproduct of rocket fuel that inhibits iodine uptake into all the tissues where iodine needs to go, including the thyroid and the breasts. Unfortunately, perchlorate exposure has gone up markedly in our country over the last 50 years. 106 lactating mothers in New Jersey were studied. They measured the perchlorate in breast milk, urine, and the drinking water. What the authors found was that the breast milk perchlorate levels were significantly higher than the other tissue. And the authors said that drinking water was not the most important perchlorate exposure source for these women. Breast milk perchlorate levels are consistent with widespread perchlorate exposure. The problem that I see is that the majority of my patients are iodine deficient and they have too high of toxic halogen levels like perchlorate in their breast milk, and these children are not getting enough iodine from the breast milk. And this is a recipe for disaster for our country. Between 1965 and 1980, the U.S. milk iodine content increased by 300 to 500% due to changes in cattle feeds. By 1986, the amount of organic iodine in cattle was limited to 10 milligrams of cow per day. And what we found is that iodine content of U.S. dairy whole milk has gone down over the years, as shown in this slide. From 1978, 602 micrograms per liter, to recent measurements less than 100 micrograms per liter. So why look at iodine? Due to iodine declining in the breast milk and perchlorate exposure and bromine exposure, which I'll talk to you about, 1.9 billion individuals worldwide are estimated to have inadequate iodine nutrition. The World Health Organization claims iodine deficiency is the world's greatest single cause of preventable mental retardation. They estimate there are 300 million school-age children worldwide who are iodine deficient. That includes 36% of school-age children across the world, including our own. And over half of the population in Europe lives in an iodine deficiency area. And in fact, 1/3 of the world's population lives in an iodine deficient area. That encompasses 129 countries, including our own. Studies have shown decreased childhood survival rate in iodine deficient areas, and neonatal mortality has been shown to decline over 50% when iodine deficiency is rectified. We have a plethora of neonatal ICUs across the United States, and we haven't seen a decline in neonatal mortality over the last 30 years. I believe this is due to iodine deficiency that's not being recognized and not being treated. And in fact, 72% of the world's population is currently affected by iodine deficiency, including our own population. So why look at iodine? 100 consecutive healthy pregnant Bostonians were studied. 50% were found to be below the RDA for iodine. 9% were found to be what the World Health Organization recognizes as severe iodine deficiency. Now, autism is growing at epidemic rates in our country, and is similar to the US, a pattern of iodine decline in a population and a concomitant increase in autism has been seen in other Western countries, including England, New Zealand, Australia, and Italy. Now, iodine is not only associated with autism, it's associated with cholesterol problems. In 1918, researchers demonstrated that feeding iodine to rabbits could prevent the deposition of cholesterol in the arteries of rabbits that were fed cholesterol. These studies were reproduced, and similar results reported in the literature 4 times. One of the studies was right here. Researchers looked at the development of atherosclerosis in rabbits. They had a control group of rabbits fed a high cholesterol diet, a treatment group of rabbits fed a high cholesterol diet, and treated with either thyroid hormone, desiccated thyroid hormone, or iodine. The study found control rabbits fed cholesterol developed marked aortic atherosclerosis. The rabbits fed a cholesterol-rich diet and T4, or thyroid hormone, showed slight to moderate atherosclerosis. The rabbits fed a cholesterol-rich diet and either desiccated thyroid hormone, which is natural thyroid hormone, or iodine, showed an absence of atherosclerosis. So this study shows that iodine has an independent positive benefit in a cholesterol-rich diet, as well as a synergistic effect with desiccated thyroid hormone. It is my view that the atherosclerosis epidemic that we're seeing is being driven in part by iodine deficiency. So, more information about iodine and cholesterol levels. 136 subjects were studied. They looked at iodine intake and lipid parameters. Compared to iodine-sufficient non-goitrous controls, iodine-deficient goitrous subjects had significantly higher cholesterol levels and higher LDL cholesterol levels. Now, we have a lot of medications to treat high cholesterol levels and high LDL levels, but people aren't getting high cholesterol and high LDL from a lack of statin drugs. They're getting this condition from eating a poor diet and being iodine deficient. Now, you would think that with what's known about iodine and the development of IQ in children, that most prenatal vitamins would contain iodine. But as this study shows, most prenatal vitamins lack adequate iodine. And in fact, only 28% of prescription prenatal vitamins contain iodine. The average iodine content of iodine-containing prenatal vitamins was found to be below the RDA for iodine. And of the prenatal vitamins that do contain iodine, only 15% have more than 150 micrograms of iodine per daily dose. I say this is a public health disaster that's unparalleled. Why look at iodine? Well, iodine normalizes the pH of the body. It's an alkalinizing agent which raises the pH. Its deficiency causes intellectual deficiency, goiter, hypothyroidism, autoimmune thyroid illness such as Hashimoto's or Graves' disease, thyroid cancer as well as other cancers. It's necessary for the production of all the thyroid hormones, T4, T3, T2, and T1. In fact, it's necessary for the production of all the hormones of the body. You cannot make a hormone in the body without adequate amounts of iodine. That includes the adrenals, the ovaries, the testicles, and other endocrine tissue. And iodine is also responsible for the formation of the normal architecture of the glandular tissue, and that's been found in the breast, the thyroid, the ovary, and probably the prostate, although the studies haven't been completed for that yet. Iodine is a trace element found in small amounts in the human body. It's usually found in seawater and sea organisms, such as seaweed. And the soil near the ocean can contain larger amounts of iodine. Therefore, those plants grown there will have larger amounts of iodine in them. And we know iodine can combine with salt, and you can get iodized salt. So the therapeutic actions of the most misunderstood nutrient are that iodine is a great alkalinizing agent. It normalizes the pH. There's no bacteria that's been shown to be resistant to iodine. Iodine has anti-cancer properties. It can take cancer cells and turn them back into normal cells. There's only a few substances we know that can do that, and iodine is one of those substances. There's no fungus that's been shown to be resistant to iodine. There's no parasite that's been shown to be resistant to iodine. There's no virus that's been shown to be resistant to iodine. Iodine is a good detoxifying agent for bromine, perchlorate, mercury, arsenic, and other agents, and it's a great mucolytic agent. Not bad for the most misunderstood nutrient. This slide shows many conditions treated and prevented with iodine. This is a who's who of who's not feeling well out there and who's going to their doctor looking for answers. Now, many of these conditions are treated with drugs, but these drugs don't treat the underlying causes of these conditions. They just treat the symptoms of the conditions. Most of these conditions have nutritional and hormonal imbalance as their underlying cause, and iodine is a principal agent in this. So iodine is not very soluble in water. Dr. Lugol in 1829 found that when potassium iodine was added to water, it increased the solubility of iodine. He came up with Lugol's solution. And Lugol's solution is 2 drops of Lugol's contains about 12.5 milligrams of a combination of iodine and iodide. So in the 1800s, Lugol's solution was widely available at most apothecaries. It was recommended for almost any condition, including infection. And it was probably the most used medical item before patent medicine took hold in the early 20th century. Now I'm just reminding you, here's what the RDA for iodine is: 150 micrograms a day for the adult male and female, a little bit more in pregnancy and lactation. However, what Dr. Abraham taught me was that different tissues of the body bind different forms of iodine. As can be seen in this slide, the breast, the prostate, and the stomach primarily bind iodine, the oxidized form of iodine, whereas the thyroid, the salivary glands, and the skin bind the reduced form of iodine known as iodide. My experience is clear. If you're going to use iodine for any condition in the body, it's better to use a combination of iodine and iodide versus one form alone. You get a whole body effect using it that way and a much better clinical effect. So where's iodine found in the body? Every cell in the body contains and utilizes iodine. In fact, the white blood cells cannot effectively guard against infection without adequate amounts of iodine. It's concentrated in the glandular system, such as the thyroid, the breasts, the ovaries, the uterus, and the prostate. The thyroid gland contains the largest concentration of iodine, 50 milligrams at saturation, although many other tissues contain large amounts of iodine, including the breast, the salivary glands, the parotid glands, the pancreas, cerebral spinal fluid, the brain, the stomach, the skin, the lacrimal glands, etc. The first U.S. iodine studies were done in Akron, Ohio by Dr. David Marine. He was a physician there who was studying the goiter epidemic that was occurring in his area. And the goiter epidemic was occurring not only in humans, but it was occurring in animals. And the animals were not growing to the right size. And there was a worry that the expanding human population was going to outstrip the food population. So he gave varying amounts of iodine to farm animals and found which amounts of iodine decreased their goiter rate and caused them to grow to the right size. From there, he estimated the amount of iodine necessary to treat humans. And the first study, like I said, was done in Akron, Ohio, where 56% of school-age girls had goiter or swollen thyroid, and there was a higher incidence of puberty. The reason there was a higher incidence of puberty is that the first tissue that grows in girls at puberty is their breasts. The breasts have a very high iodine concentration, and at puberty, a girl's iodine needs go up compared to a boy's. There was a 600% increase in goiter in girls versus boys in Akron, Ohio at the turn of the 20th century. Dr. Marine stratified the students into 2 groups, a control group of 2,300 students where no iodine was given, a treatment group of 2,100 students where 9 milligrams of iodine was averaged daily for 2.5 years. And this was over 100 times the RDA for iodine. He found no side effects with using 100 times the RDA for iodine. His results were stunning. The control group had 22% goiter, and the treatment group had 0.2% incidence of goiter. Dr. Marine repeated these same studies in Michigan, and he found the same results. By 1924, iodized salt was introduced to the area. By 1928, 4 years later, goiter had decreased 75%. The United States quickly added iodine to salt for the rest of the country. It was hailed as the first public health miracle. This is a map of World War I recruits, and it's looking at goiter in World War I recruits. And you can see iodine deficiency was occurring across the entire United States in the turn of the 20th century, from north to south and east to west. This was before the introduction of iodized salt. Now, how do you ingest iodine? It's a trace element, not very common in most foods. It is in some ocean foods and ocean fish such as cod, sea bass, haddock, and perch. And it's in sea vegetables such as seaweed. But it can be found in food products if iodine is added to the animal feed or the food source such as salt. In 1831, Boussingault proposed iodized salt to prevent goiter. It took the U.S. nearly 100 years to implement his instructions. I always make the statement that conventional medicine is 100 years behind what we're doing in holistic medicine, as illustrated by Boussingault's recommendation in 1831. Iodized salt has potassium iodide in it. It supplies 74 micrograms of iodide per gram of salt. It is a cost-effective way to prevent goiter or swelling of the thyroid. It's an effective tool to decrease the presence of goiter. However, it's inadequate to provide for the body's need for iodine. This study illustrates the low bioavailability of iodine in salt. Two groups were studied here. This was done in 1969. Group 1 got iodized salt, Group 2 got iodized bread. They both got 750 micrograms per day of iodine in both groups. Keep in mind, the RDA for iodine is 150 micrograms per day. The expected serum result, if you drew someone's blood after taking in this amount of iodine, would be 17.2 micrograms per liter. But what they found was a significantly different result than the expected result. Here was the expected result. The next slide shows the bread group. And the third slide shows in yellow the salt group. You can see here only 10% of the iodine in salt is bioavailable. Is this because of competitive inhibition by chloride in salt? I doubt it. We need chloride in our body, we need gram amounts of chloride. So I would say that this is because salt has items in it that inhibits iodine absorption. And I talked to you more about that in my salt book. But who would still recommend iodized table salt? Only those people who are misinformed about iodine and misinformed about the right kind of salt. I use unrefined salt in my practice and in my diet, and I would encourage you to look into this and to use unrefined salt for you and your family. Now, unrefined salt does not have iodine in it, so you're going to have to supplement with iodine if you use unrefined salt. This is just to remind you, from 1971 to 2000, iodine levels have declined 50% in the United States. During this time, there's been increases in thyroid illnesses, cancer of the breast, the prostate, endometrium, and the ovaries, and all of those conditions can be caused by iodine deficiency. At the Center for Holistic Medicine where I work, 94.7% of patients tested had significantly low iodine levels. Those were the first 250 patients that I tested for iodine. Now we've tested over 5,000 patients between myself and my partners. Our results have consistently shown over 96% have tested low via urine and/or serum testing. Iodine deficiency is occurring today, and it is occurring at epidemic rates, and we are suffering the consequences of it. So why are people so deficient in iodine? Well, number one, our soil is very deficient in iodine. It's more common in inland and mountainous areas, especially in the Midwestern United States where I'm from, in the Great Lakes Basin. But we have soil erosion from glaciers and deforestation and poor farming techniques adding to the problem. And one of the main problems we're seeing today is pollution from pesticides and insecticides, which contain toxic halogens, which competitively inhibit iodine in the body. I say this is a national and a worldwide problem. Now, there's not much iodine in food. This slide shows you that most foods do not have enough iodine in them to supply our daily needs. Just to remind you, iodine levels have fallen 50% in the last 30 years. Hopefully by now you're asking yourself the question, why has this happened? Why are people deficient in iodine? Well, most people aren't using iodized salt. I see many patients who come in and say they're healthy because they're not using any salt in their diet and they're afraid of getting hypertension from using salt. And it's estimated that less than 50% of US households presently use iodized salt. I will tell you, if you're not using the right kind of salt in your diet, by my definition, you are salt deficient. We need to use unrefined salt with its full complement of minerals. Radioactive iodine use in medicine only works in an iodine deficiency state. Chemical exposures from goitrogens. These are bromine, chlorine, and fluoride items, and they're found in drugs which contain fluoride and bromide. These competitively inhibit iodine binding as well as decrease iodine uptake. And nitrate, perchlorate, thiocyanate, they're competitive inhibitors of iodine at the iodine binding molecule. We also have declining mineral levels in general in our food from soil erosion, poor farming techniques, and we have dietary problems why people are deficient in iodine. Soy is a known goitrogen. It contains compounds that inhibit thyroperoxidase, an enzyme in the thyroid gland. These are found in daidzein and genistein containing supplements, and when low iodine levels are present, soy compounds block TPO catalyze tyrosine iodination by acting as alternate substrates, and they produce chemicals that shouldn't be produced in the thyroid gland. This further worsens iodine deficiency, and it can occur with low or intermittent doses of iodine. I do not recommend anyone to ingest soy or to take soy-containing supplements in their diet, as soy is a known goitrogen and can interfere with iodine absorption in the thyroid gland. Now, the main dietary reasons for iodine deficiency are diets without ocean fish or sea vegetables, or inadequate use of iodized salt, including low sodium diets. Vegan and vegetarian diets are notoriously low in iodine. Bromine in food and drink is a major cause of iodine deficiency. There's brominated vegetable oils added to many products, such as some Gatorade products, Mountain Dew, and other soft drinks. And bakery products, breads, pasta, and cereal, all contain bromine. Why do bakery products contain bromine? This didn't used to be the case. In fact, in the 1960s, iodine was added to bakery products as a conditioning agent. One slice of bread contained the RDA for iodine, about 150 micrograms. But in the early 1970s, bromine was substituted for iodine due to misinformation about iodine. And what did this substitution do? The substitution for bromine for iodine created a double whammy. It worsened an iodine deficiency problem already present in the United States, and it competitively inhibited iodine in the body by adding a known goitrogen, bromine, to bakery products. The substitution of bromine for iodine in bakery products has been a disaster for our country. In fact, I say this could be the most asinine act amongst many in the history of the food industry, and it's still occurring today. Bromine is a toxic substance with no known value in the body. It's in the family of halides such as iodine, fluoride, and chlorine. All halides compete with one another for absorption and receptor binding. Bromine interferes with iodine utilization in the thyroid as well as other areas of the body. It's a known goitrogen, causes swelling of the thyroid, and is known to bind to wherever iodine binds to, including the thyroid, the breast, the prostate, and other tissues of the body. This is a picture of a new car and its releasing of different agents into the air. And you can see from this picture, bromine is released all over the place in a new car. I have a patient, Julie, who saw my lecture in Detroit. Julie had a severe fibromyalgia picture, was doing well for a couple of years, and all of a sudden all her symptoms returned, and we couldn't figure out why. She saw me do this lecture on iodine, saw this slide, and she caught me after the lecture and said, all these symptoms started 2 weeks after my husband got a new car. We evaluated Julie for bromine levels. Her bromine levels were very high. We detoxified her for bromine, which I talk about more in my book, including using higher doses of iodine. And 3 weeks later, Julie's symptoms all disappeared. She was feeling much better and got back to her usual state of health. Animal studies show that bromine intake can adversely affect the accumulation of iodine in the thyroid and the skin. A high bromide intake results in iodine being eliminated from the thyroid gland and replaced by bromine. And the ingestion of bromine has been shown to cause hypothyroidism in animals. When iodine deficiency is present, the toxicity of bromine is accelerated in the body. Unfortunately, the toxicity of bromine is going up in our population. My testing has shown that nearly every patient has high bromine levels, and therefore will require iodine as a supplementation to help get the bromine out of the body. Bromine is an antibacterial agent for pools and hot tubs. It's a fumigant for agriculture, and it's sprayed on fruits and vegetables. Crops where it's sprayed on are found to contain high bromide levels. And it's a fumigant for termites and other pests. In 1981, 6.3 million pounds of bromide were sprayed in California. By 1991, it was up to 18.7 million pounds of bromide. Present numbers aren't known today. There is talk of outlawing bromide spraying on the crops, and that should be done immediately. Bromine has been shown to decrease the sex drive and sperm count of mice. It enhances estrogen receptors, it downregulates progesterone receptors, and there's 33% fewer male births of women with the highest exposure to brominated compounds such as PBDEs and PCBs. Right now we're experiencing an infertility problem, and I believe it's directly related to iodine deficiency and hormonal irregularities, as well as bromine toxicity. Pesticides contain organic bromine. The amount of bromine in human breast milk has increased tenfold over the last decade, according to the EPA. How much iodine is stored in the body? The thyroid stores 50 milligrams per day at saturation. The breasts store a minimum of 5 milligrams per day. That's in a 110-pound woman for maintenance of normal breast tissue. However, a larger woman, or a woman with larger breasts, will have an increased requirement. Men have smaller breasts and a lower iodine requirement. Other glandular tissue, such as the adrenals, the thymus, the ovaries, etc., have a minimum of 2 milligrams per day. You can see these amounts are much higher than the RDA for iodine. The RDA is not adequate for our needs in today's toxic world. So how do you check iodine levels? You can do blood levels, saliva levels. Skin testing is always asked of me, and where you rub iodine on the skin and observe for the disappearance of the iodine. You would pick a spot on the arm, rub a little bit of iodine on, and see how long it takes for that brown to go away. If the iodine goes away within 24 hours, you are told that you are iodine deficient. However, a study found that 88% of the iodine put on the skin evaporates into the air. I do not think that's an adequate way to measure iodine levels. I think the urinary excretion tests or the urinary measurements are the best level, and those have been used the most over the last 50 years. And I believe an iodine loading test is the best way to check iodine levels. I describe this in much more detail in my book. Iodine dosage guidelines. The RDA for iodine is 150 micrograms per day. The RDA is inadequate to supply the body's need. The dose must be individualized. And I believe when you're going to use iodine, to use a combination of iodine and iodide, not to use one form only, and to do appropriate testing pre and post to get the best results. Now, if you recall the definition of medical iodophobia from my mentor, Dr. Abraham, medical iodophobia is the unwarranted fear of using and recommending inorganic, non-radioactive iodine within the range known from the collective experience of 3 generations of clinicians to be the safest and most effective amounts for treating the symptoms and signs of iodine deficiency from 12 to 50 milligrams per day. I couldn't agree more with this quote. Medical iodophobia is prevalent in holistic circles, it's prevalent in conventional circles, and it's prevalent because of the ignorance of iodine. So my final thoughts are that iodine deficiency is common. It's not rectified by the use of iodized salt. And iodine deficiency may be the underlying cause of the epidemic of autoimmune thyroid disorders such as Hashimoto's and Graves' disease. Using a combination of iodine and iodide is more effective than using one form alone. And the best results are achieved with a holistic approach where iodine is combined with vitamins and minerals, diet, detoxification, hormone balancing, etc. Now, it's important when you use iodine to make sure magnesium levels are optimal, and I wrote here electrolyte supplementation. What that means is ensuring that you have adequate amounts of good forms of salt coming in your diet, such as unrefined salt. Over 20 years of practicing holistic medicine has clearly showed me there's nothing more important in my practice than ensuring adequate iodine levels. I would encourage all of you to read more about iodine, become more knowledgeable about iodine, and ensure that you and your family have adequate iodine intake. I'm Dr. David Brownstein. Thank you for joining me today.